ABGs. And as Albert Einstein says, if you can't explain it simply, you don't understand it well enough. Which means, whatever is the complex things about ABG, if you cannot really make it to simple terms and understand the condition, it's of no use. So today we are going to talk about ABGs and playing tic-tac-toe with ABGs and see how we can break down this complex, scary thing into really simple matter so we can understand it better and we can treat our patients better. Now, I'm thinking that whoever is seeing this video, you already know a little bit about ABG. I mean, it's about acid base balance, and ABG stands for arterial blood gas. So when we talk about ABGs, we need to know a little bit more about gas exchange and why it is important to know about ABG and how to interpret it and everything about compensation. And I know that's something everybody is scared of because they are like, is it compensated? Is it partially compensated? Or is it uncompensated? I have no idea. So I'm going to give you 100% confidence that after this video, you are going to literally do it yourself and you are going to tell if it is compensated, not compensated, or uncompensated. Okay, that's a deal between you and me. All right. So today we are going to go a little bit into our respiratory system just to make sure that you are in the right path to know everything, to learn everything. Okay, so this is our respiratory system. Just an anatomy physiology overview. See, we have our sinuses, there comes the larynx, and then the trachea, and then you have the lungs, and it goes further detail. Then you have the bronchiole and alveoli. Now, where does this gas exchange take place? Like you breathe in air, you breathe out air. Well, you breathe in oxygen, you breathe out carbon dioxide. But where exactly is this gas exchange happening? It's in this tiny little part called alveoli. And it's surrounded by blood. So you have all this gas exchange going on there. So just to see it in more detail, here is another picture of that. The gaseous exchange in the alveoli. See how the oxygen, the inhaled oxygen comes in, and then this is the alveoli lining, and there is an epithelial cells here, and you have your deoxygenated blood carrying carbon dioxide because this is your capillary, and then somewhere here, the carbon dioxide goes there and oxygen comes in, then you get the oxygenated blood, which will go back to heart and it will go to the circulation to go to every organs. Now, so the alveoli are the primary gas exchange units. That's where the oxygen, the oxygen comes in and carbon dioxide goes out. Now, it's not in the trachea, it's not in the bronchi, and it's not in the bronchioles. And do you know how many alveoli we have? Like, take a wild guess. 100,000? Maybe 20 million? Almost. We have 25 millions of alveoli at birth. And it goes up to 300 million by adulthood. So it's a lot of people working there. And what you have to understand is the gas exchange needs an intact alveoli. If your lung tissues are scarred by smoking or whatever reason, or irritants or toxins, then this gas exchange won't take place like it should be. Okay. So we are going to go a little bit more detail in here. Let's see. Now that we are going to talk about the ABG, like I said earlier, I just wanted to let you know that what is ABG. ABG is arterial blood gas. Now, that's a blood test, right? It's a blood test, and it tells you what is the pH, what is the level of oxygen and carbon dioxide in your blood. That's exactly what ABG is going to tell you. And depending on the results you get after the blood test, you can categorize them as, is it acidosis, meaning it's more acid there, or is it alkalosis, meaning there is more alkali there, or is it respiratory, is it metabolic? And then you can make out, you can suggest the treatments or whatever the interventions and nursing management we need to do. Okay, so what are the main elements in interpreting ABG? Now, there are so many other values in ABGs, but there are three which I really want you to focus on for the purpose of this tutorial. One is pH value, the other one is bicarbonate level, then it's PaCO2 level. Now, pH value is going to tell you is it compensated or not, because your body is always trying to maintain the normal pH, which is between 7.35 to 7.45. That is the optimal level of pH in your blood, so all the normal functions can take place there. Okay, bicarbonate is a metabolic product that says as HCO3, that's bicarbonate, and that is a metabolic product. Now, PaCO2 is your partial pressure of carbon dioxide. Now, whenever a gas comes into the bloodstream, it exerts a little bit of pressure, and that pressure is called the partial pressure. So the CO2 partial pressure is stated as PaCO2. Okay, so that has something to do with respiration, right? So are we clear on that? The CO2 is considered as the acid part in ABG because the CO2 is actually the gas form of carbonic acid. So it's the gas form of carbonic acid because when CO2 dissolves in water, it makes carbonic acid. So CO2 is considered as something acidic, okay? And HCO3 or bicarb is considered as the alkaline part, and that's the metabolic part of ABG. So are we clear with that? We need to see three things: pH, bicarb, and PaCO2. And if you have these three values with you, I can guarantee you that you can decide if it's a respiratory acidosis, metabolic acidosis, respiratory alkalosis, or metabolic alkalosis, and it's compensated or not compensated or partially compensated. All right, you need these three values. Okay, here we go. What we do here is a little bit concept. See, this is the pH, this is the bicarb, this is the carbon dioxide. These two guys has to work together. The bicarb and the carbon dioxide has to work together to maintain the pH. If one is not working, the pH is not going to be normal. If both are trying to do it together, it's called the buffer system, the buffering system, then the body will maintain the pH. The bicarbonate and CO2 will work together to maintain pH at normal level. Okay. Now, how will the lungs help? I mean, the main organs in this buffering system is the lungs and the kidneys. The lungs has something to do with CO2, right? It will try to adjust the ventilation, the respiration rate. Okay. So if it is retaining CO2, then you know that your blood has a lot of CO2. Like if somebody is not breathing, right, or they are breathing very slow, then they are retaining CO2. Now, if somebody is breathing really fast, then they are going off all the CO2, right? So that's how the lungs help in maintaining the pH by adjusting the respiratory rate, how fast or slow you breathe. and it will either retain the CO2 or it will blow off the CO2. All right, and that's how the lungs take part in this buffer system. Now, kidneys can deal with the bicarb section. That's the metabolic. Remember, CO2 is the acid, is the respiratory part. Bicarb is the base and is the metabolic part. So here comes the kidneys. Kidneys can reabsorb bicarbonate or regenerate new bicarbonate, and it can help that way. So it will buffer the system. Now, ABG's results give you the data required to assess any condition. Okay, so we will do a little bit more here. It's very important to know what are the normal values of all these things like pH and HCO3 and PaCO2. The normal pH value is 7.35 to 7.45. The normal bicarbonate level is 22 to 26. Now PaCO2 level is 35 to 45. Now if pH is less than 7.35, it's acidosis. If pH is more than 7.45, it's alkalosis. Okay, so you have acidosis, alkalosis. In the middle is the normal, 7.35 and 7.45. Now, HCO3, if it is less than 22, it's acidosis. Remember we talked about that, right? HCO3 is a metabolic base, and if it is more, that means it's more alkali. It's like base, right? It's more leaning towards base. So if you have more HCO3, which is if it is more than 26, then it's alkalosis. If it is less, it's acidosis. PaCO2 is the opposite because we consider carbon dioxide as acid, remember? So if there is more PaCO2, which meaning there is more acid, so we will consider it as acidosis. If it is less, it's alkalosis. So are we good with that? You need to remember and learn this. The normal pH value, normal HCO3, normal PaCO2 values. These values are very important for you in order to see if it is an acidosis or alkalosis. So if it is and also you need to know that the PaCO2 or CO2 is an acid part. It has to deal with the respiratory problems. So if it is an acid part, if it is more, then it's an acidosis. If it is less, it's alkalosis. The base, the HCO3, the bicarbonate, if it is more, then it's alkalosis. If it is less, then it's acidosis. Okay? Okay. Just to recap, there we go. This is the neutral, and 7.35 to 7.45 pH is the normal. 35 to 45, this road completely, that's respiratory, and 26 to 22, that is metabolic. Okay, so know the normal values. How to interpret ABG using tic-tac-toe? There is a fun part. Okay. What do we do first is to draw a tic-tac-toe. Okay, and I'll try to do that here with this little pen here. Let's see if that works. Okay, so you just draw two lines there, and then you just, my lines are not so correct, but that's okay. So this is your tic-tac-toe. Then you just put your acid, then your normal. My end doesn't work great. Okay, and then you have your alkaline or your base. You can either write alkaline or you can write base. Okay, so this is your acid part, this is your normal, this is your alkaline, and this is your tic-tac-toe. Okay, my tic-tac-toe doesn't look that nice, but that's okay, right? Okay, all right, this is cool. This is really good. So you just make your tic-tac-toe and you just write acidic, normal, basic. That's more neat. Okay, after that, we decide on the ABG values and mark them on your tic-tac-toe. So we have to refer back to our normal ranges, okay? So you need to know the normal ranges in order for this to work. So if you figure out, let's do one here. For example, the pH is 7.32. Now we had our tic-tac-toe there. Then we wrote acid, normal, and base. And then we looked at it. Okay, pH is 7.32. What does that tell me? The normal value is 7.35 to 7.45. So if it is less than 7.35, then I know it's acidosis. So what am I going to do? I'm going to write that under the acid because it's acidosis. Now, PaCO2 is 48. What was the normal value of PaCO2? It was 35 to 45. So 45 was the maximum. Now, what do I know about CO2? I know it's an acid. I know the more it is, the more acidic it is, which means if it is more than 45, which is the normal value, and it's 48 now, it should be acidic. So I'm going to put PaCO2 under my acid right there. So you have your pH and PaCO2 there. We have one more value here, that's HCO3. Now, what do I know about HCO3? I know it's a metabolic thing. I know it's the base or which makes it alkaline. And I know the normal values are from 22 to 26. So if it is more than my normal value, which is 26, it's 27, so I will consider it as more alkaline or base. So I'm going to write that down under my base. All right, so I have my tic-tac-toe ready now. If you can see that here, this is my tic-tac-toe, right? Okay, let's see if I can just write down here. This is my tic-tac-toe. So what do I know here? I know it's acidic because the pH is less and this PaCO2 is here. So I know it has something to do with respiratory. So I am diagnosing this condition as respiratory acidosis. Okay, see how easy it is? Whenever you get your tic-tac-toe, whatever values they are representing the state is your condition. So this is respiratory acidosis. All right. We will go into compensation part a little later. I don't want everything to confuse you right now. So let's just deal with this one now. Okay. Now there is one. A patient blood gas revealed the following findings. pH is 7.3, bicarbonate is 27, carbon dioxide is 58. What is the interpretation of these gases? Now, let's see if we can make our tic-tac-toe. Maybe not all that good when I draw it with this computer pen, but I'll try my max. All right, let's choose another color here. All right, this is our acid. I'm not writing the entire letters here. This is my normal, and this is my base, right? The basic part, the base part, or the alkaline part. Okay, now I'm going to look at what I have here. Let's see, the first one is 7.3, which is your pH. Now, if the pH is 7.3, where does that stand? It's 7.3 meaning 7.30, okay? So is that less than the normal or more than the normal? Now, the normal value was from 7.35 to 7.45. This is less than normal, which means it's acidosis. Okay, so I'm going to write my pH here because it comes under the acidosis. Okay, so pH goes here. Let's look at the second one. It's bicarbonate. It's 27. Now, what do we know about bicarbonate? We know it's a metabolic thing, and we know the more it is, the more alkaline it is. And we know the normal value is from 22 to 26. So 27 is more than normal, and it is alkaline. So we are going to write our bicarbonate, which I am going to write HCO3 right here in the base. Now, what do we know next? Carbon dioxide is 58. Now, about carbon dioxide, we know it's a respiratory thing, and we know we considered it as an acid. So the more it is, the more acidic it is. So what do we know now? If it is more acidic, we know we are going to put it under here. So we are going to put our CO2 here. Well, done. So we got our tic-tac-toe here with 3 values, and it's acidosis and it's CO2 related. So we are going to say it's respiratory acidosis. So this is our correct answer. Okay. Now, to understand the concept a little bit more, why CO2 and HCO3 are abnormal? Because it's a teamwork. To maintain the pH, they both have to work together. So they are working hard, and that's why they're abnormal. They are working hard to get this pH back to normal. Okay, so respiratory system is also working. The renal system, the kidneys, the bicarbonate side is also working. Both of them are trying hard to get this pH into normal, and that's why it is abnormal. All right, okay. Now let's see the next slide. Let's just talk about compensation here. Compensation is the renal and respiratory adjustment to changes in pH. Like I said, if the pH is normal, we can say the body is compensated, right? The pH is normal, meaning whatever was going on underneath the bicarbonate system and the respiratory system, the CO2 and the HCO3, were successful to put it back, put the pH back to normal. So the body is compensated. How does a respiratory system help? They compensate by adjusting the CO2 level by changing the respiratory rate. You breathe faster or slower. The renal system compensates by adjusting the bicarbonate level. So it will either absorb more bicarbonate or it will regenerate bicarbonate, making it the urine more acidic or alkaline. Now, how to identify compensation? I want you to remember this. Just like you have to remember the normal values, you have to remember this. All right? If pH is normal, PaCO2 and HCO3 are abnormal. The patient is compensated. Like I said earlier, if the pH is normal, the body is compensated because the HCO3, the bicarbonate, and the acid level, the CO2 will be still abnormal, and that's okay because that means they are trying, they are doing their work, they're trying hard, and they succeeded in making this pH level normal. So pH is normal, PaCO2 and HCO3 are abnormal. Its body is compensated. All right. Okay. If all 3 values are abnormal, meaning the pH, the HCO3, and the CO2, like the examples we saw earlier, the examples we did earlier, right? All 3 are abnormal. The body is partially compensated. And why do we say it's partially compensated? Because we know that the buffer system is working, the HCO3 is working, CO2 is working, but they haven't reached the normal pH yet. They are trying hard. We know that it's a teamwork. They're trying hard, but it hasn't reached there yet. Because, how do you know that? Because the pH is still abnormal. So we will say it's partially compensated. Now, if the pH is normal, we will say it's fully compensated. All right. So if all three values are abnormal, it's partially compensated. Now there can be one more session where the pH is abnormal and one of these guys, like either PaCO2 or HCO3, is normal. What does that tell us? Well, here we go. The pH is abnormal, so the body has to try, the PaCO2 and HCO3 has to try as a team to get this pH back to normal, right? Now one of them is doing the work. PaCO2 or HCO3, which one? One of them is working, but the other guy is saying, "Oh, you can go and do your job. I'm not helping you." He is staying normal. That means there is no teamwork. The pH is abnormal. One of these guys are staying normal, not helping. Then it is uncompensated because there is no compensation. These guys are not working together to bring back this pH to normal. So it is uncompensated. So remember these three sentences, all right? And understand it. If the pH is normal, the body is compensated. If all three values are abnormal, it's partially compensated. If pH is abnormal and one of the other guys like HCO3 or PaCO2 is normal, then it's uncompensated because there is no teamwork. If there is no teamwork, it's not going to happen. All right? Okay. Now let's do some examples. Well, we have a lot of examples. I wish I could draw it in a piece of paper and show it to you. So it'll be more. I'm sure if you can see that. Okay. Now let's see. First one. I'm going to make my tic-tac-toe. Can you see my tic-tac-toe? There we go. All right, that's my tic-tac-toe. Then I'm going to write down the first one is acid. The second column is normal. The third column is base. So this is my tic-tac-toe, right? There is acid, normal, and base. Let's look at the first one. pH is 7.47. Now let's see. What do we know about pH of 7.47? What was our normal value for pH? 7.35 to 7.45. So obviously 7.47 is more. So if it is more, it is alkalosis. All right. So what are we going to write? We are going to write down our pH under the base. Right? We are going to write down the pH under the base because we know it's more, and so it's more means it's more alkalosis, right? So pH under the base. What is the next one? PaCO2, and it's 22. What do we know about PaCO2? It's an acid and it's a respiratory thing, and the more it is, the more acidosis it is. What is the normal level of PaCO2 again? Well, but it was 35 to 45. Now, 22 is way less than 35, which means there is not much acid there. So if there is not much acid, it has to go under alkalosis, right? If it is less, that means it's more alkalosis because we consider PaCO2 or CO2 as an acid. So if there is less acid, it's more alkalosis. So what are we going to write? Where are we going to write that? We are going to write that under our base or alkalosis. Okay. So we got our pH and our PaCO2 under the base. Right? Okay. Let's look at the next one. It's HCO3 is 20. Well, what do we know about HCO3? It's a metabolic thing. The more it is, the more alkalosis it is. So this is not normal. The normal values were 22 to 26. So it's less than 22. So 20 is obviously less than 22. So we are saying it's more acidic, right? Because HCO3 is considered an alkaline part. And if it is less, then it's more acidosis. So we are going to write our HCO3 under our acid. See the HCO3 there? Okay. So now we got our tic-tac-toe. This